You have found Authentic Business Adventures, the business program that brings you the struggle stories and triumphant successes of business owners across the land. Past episodes of the Authentic Business Adventures program can be found on the podcast link at drawincustomers.com. I am super excited because I have Barb Schlaefer, owner of J.C. Rosen Associates. And Barb, I have known you, I want to say since 2006.
That's probably accurate.
I think I met you the first year that I started Doc Jam's Printer Repair, and you were working somewhere else, and you started your own business.
That's true. Wow, good memory.
You were in Fitchburg?
At the time?
Yeah.
I think so.
I can't even think of the name of the company. Doesn't matter. They're not important.
Yeah.
What matters now is
right.
that you started your own gig.
True.
And let's start with, what does J.C. Rosen Associates do? Let's start there.
Yeah, so that's evolved.
Oh,
since
okay.
2007, like most businesses do, right?
Sure.
You have
We're
to change.
pivoting constantly.
Pivoting, yeah, exactly. And when I started my business, I worked as, was very focused on insurance.
Okay.
In terms of for businesses.
Okay. So business liability insurance?
No, employee benefits.
Employee benefits. Okay.
Health insurance.
So the health, dental, vision.
And that hasn't changed all that much, but I'm pivoting for the last couple of years away from being an insurance agent to being an employee benefits advisor.
Oh, all right. Tell me about that.
So what we do is we work with small to medium-sized businesses, actually all sizes. I really have to also change that. Doesn't matter what size company you work with.
Somebody comes to you with 10,000 people, you're like, no.
Yeah, I can help them.
Okay.
Yeah, exactly.
Sure.
But what we do is very laser focused on bringing healthcare spend down.
That is a tough nut.
It's a tough nut, but it's not impossible. It's not impossible.
Okay.
Most people will agree that healthcare in this country is broken.
If they don't, they're not paying for it.
Exactly. However, and most people feel like, it's such a mess and it can't be fixed. Well, it's not true.
I'd agree with half that.
It's not true.
Anything can be fixed, right?
Yeah. Or they feel like, the solutions are complicated.
Okay.
So we focus on that. And in our country, and this has been around since the 50s, employers are primarily, they're the second spender of healthcare after the government, right? Because the government pays for healthcare, Medicare and Medicaid. They're the largest purchasers of healthcare in the United States.
Okay.
After that, it's employers.
Makes sense.
So if you're working, more than likely, if we're a larger company or a medium-sized company, you get your health benefits through where?
Through that company.
Through your employer.
Sure.
Your employer. And so that becomes an expense for the business. A large expense.
I get to pay that expense.
You know what I'm talking about.
I know.
So for most employers, the second largest expenditure after payroll is benefits.
All right.
Healthcare.
Sure.
And it's not getting any cheaper every year.
It is not.
It's not getting any cheaper. Every year, your premiums go up probably anywhere between 8 and 15%.
Yes. And then we're told that we're lucky.
Exactly. Oh, you're lucky. Oh.
They only went up 8%. You're lucky.
You're lucky. You know why? Because you are at trend.
Sure.
You're told this.
Right.
Medical trend. It's higher than inflation. We hear that all the time.
Tell me, medical trend, what does that mean?
Medical trend is what hospitals and doctors say they need each year to pay for health care. So they're saying that every year they need 8 to 10%, and they're saying healthcare expenses are going up 8 to 10% a year, and that's why we, insurance companies, need more money from you, employer.
I have never heard that phrase before, so that's interesting that you say that.
You've never heard medical trend?
No.
So when your agent sits down with you and tells you, James, it's great, you got an 8% increase.
Right.
Many times they'll say, that's trend, you're lucky.
I get an email, so I don't meet with them. And in there it says I'm lucky, but it doesn't say why.
Doesn't say why you're lucky.
I think it's just assumed
that
we could raise this 50% and you'd have no choice.
Yeah.
So,
You know, we could really hit you hard in the face, or we could just hit you in the
yeah, just kick me in the
You're
shin.
lucky.
Both shins. So how are they figuring that this expense is going up?
How are they figuring that?
Yeah.
So they say that it has to do with advanced technology.
Okay.
So, drug costs keep going up because new drugs come on the market.
Sure.
And you have to pay for that.
Mm-hmm.
New technologies come on, and we have to build bigger hospitals, more beds, we need bigger clinics. When I say, I'm not talking about myself.
Yeah.
Yeah.
Do we really?
And so that is kind of what we've always had to swallow
Sure.
as a society. Like, that's
Just accept it, that's
what
the way it is, right?
Right, and it's unsustainable.
I totally
It's
agree.
unsustainable.
Right, because eventually you break.
Are you
where you
raising
can't
your
afford.
prices 8 to 10% a year?
I would love to say that I am, but I fear that my clients would not be a fan of that.
Are your employees getting paid? Getting paid 8 to 10% more? Not your employees, but employees in general.
Right.
Broadly
speaking, no.
Right.
Right.
Squeeze.
Mhm.
We're being squeezed. So
Totally agree.
Premiums go up,
Mm-hmm.
but wages stay stagnant.
Yes.
And then all this is on the backs of us as employers.
Employers, yep. Mm-hmm.
It's our money.
Yes.
We write the check every month. We write that
Every
check.
couple weeks, yeah.
We send it to the insurance company, and I'm like,
Right.
hope that works out.
They sure have a nice building.
Sure. Do you know how much? Do you know how much you spend on healthcare? Not the premiums. How much do you spend on healthcare?
How much I personally?
Or you or your employees? Do you know how much you spend?
My employees, I do not.
No. Do you?
Me, negligible.
Why not?
Because I go in
It's a trick question.
once every 2 years to get my Fed Med card so I can keep my CDL just 'cause.
Yeah. Okay.
And the federal government doesn't allow insurance to pay for that recently.
Okay. Well, let's say.
So, yeah.
Let's say you needed a knee surgery.
Okay.
How much is that going to? How much is that going to cost you?
I don't know. Let's just say $15,000.
Well, how do you know that?
That's a guess.
Why? Why is it a guess?
Straight out of the air.
James, would you buy anything without knowing the price?
No.
Why do we do that?
We have no choice.
That's the problem.
Yes.
The problem. The problem is we don't know what we're buying.
Right. Nobody price shops an ambulance, right?
We don't know what we're buying.
Sure.
Can you imagine going to a restaurant and opening the menu and like no prices there?
Right.
And then you shut it. The waitress just brings you, a hamburger, fries, whatever. Like you don't even decide to just bring it to you.
In that case, we don't even know if it's cooked.
Because you're hungry. Because
Yeah,
you're
right.
hungry. And then you go home, and a month later you get a bill for $500.
Sure. Right.
That's what we have.
I believe this is under the whole because they can thing, right? There's a lot of people making money off this, clearly.
That's true.
Which
That's
is why it
true.
hasn't been fixed.
There's a lot of middle people. So anyway, back to what I do.
Yeah.
So what I do now is I laser focus on that healthcare spend for companies.
Okay.
So I take a look at what we have to do a healthcare audit. We
Okay.
have to find out what you're spending.
For individual employees or... Oh, okay.
Yeah. So I take a look at at the company, and I have to get information. I can't help people without information, so I have to get information from your employees in a confidential way under HIPAA. You can't ask those questions.
So I was just going to say, like,
But
I can't ask
can,
them that,
but
right?
I can.
Tell me why. Because I can't ask someone, hey, are you thinking about having a kid before
No,
you
can't.
come work?
You can't do that.
And I can't ask someone, hey, how's your heart?
No.
And I can't ask someone... I think I can ask if they smoke. I never do. Usually you can smell if they do.
Okay. Well, anyway.
But you know what I mean? Like, how come you can ask
I
those
can ask
questions?
because I'm asking for a health underwriting purpose. So I'm a licensed insurance representative
All right.
with the state of Wisconsin.
Sure.
And I have to abide by the laws of HIPAA.
Okay.
So I can be, sued if this information gets out. Or anyone can. I mean,
Sure.
so I can collect this information
Right.
from your employees.
I just wonder, because when it comes to an employee interviewing,
Mm-hmm.
you're trying to see what can I pay that employee to do the job? And as an employer, generally speaking, from an expense point of view, right, not personal point of view, you want to pay the lowest amount possible for all of your employees so that you can be the most profitable company. without being Scrooge McDuck, right? And it's also easier to pay somebody more if that money is not going towards health insurance. So to a point, wouldn't it make sense to be able to ask, like, hey, are you going to cost our insurance company millions of dollars by us having to support you? We can't.
You can't.
I just feel like, man,
Yeah.
maybe that would make the world.
It is strange. It's a weird situation, right? Because you as the employer, you can't know that information, but you have to pay for it.
Yes, absolutely. Yeah, that's a challenge.
Yeah.
I feel like the system is set up to cater to the less than healthy individuals. Because
Well-
the healthy individuals essentially have
Well, they're
to.
high users. Well, what's
Right.
Yeah.
Yeah, so there's-
through no
if-
fault of their own sometimes.
Correct.
You know.
Correct. But if
Yeah.
there was an incentive to be healthier in order to get hired, maybe
Yeah,
generally
we're not
speaking,
going to go there.
Okay.
Okay. We're not going to. Here's the thing.
Sure.
We're not. The problem is not with the employees.
Okay.
We need to shift the conversation
Mhm.
away from blaming people for
Okay.
being healthcare users.
Okay.
That is not the problem.
All right. Not exclusive. Sure.
That is not the problem.
Okay.
The problem is we don't know what this stuff costs. And when we don't know what it costs,
Mhm.
it's going to cost 3 or 4 more times more than it should.
At least, yeah. Just because they can. Sure.
So I don't know if you've ever paid cash for medical services.
I have.
Okay.
A long time ago.
So many times when you don't have insurance
Mhm.
and you need to get a service,
Mhm.
you'll ask, well, I don't have insurance. What's the cash price?
Mhm.
You will notice almost most of the time your cash price is going to be 30 to 40% lower.
It is.
Yes.
I'm trying to think.
Why is that?
So I busted up. I tore some tendons. I went to the emergency room. This is decades ago. And at no point were they just like, this is going to cost XYZ, right?
Mm-hmm.
I just got a bill,
Mm-hmm.
and essentially, I don't know, I was 20 something, right? So I had zero cash. So they're pretty much just like, make payments.
Mm-hmm.
And I
Yeah.
think this was back, a long time ago.
Mm-hmm.
They didn't charge interest,
Mm-hmm.
but they essentially kept sending bills, and I
Yeah.
kept making payments, whatever.
Yeah.
It took forever.
Yeah.
But I'm like, that was just a little knuckle thing.
Mhm.
What happens if you actually have a real
Yeah.
something?
Exactly.
There's a lot of cash for the 45 minutes I was there. 45 minutes of actual stuff
Yeah,
happening.
and everyone has a story like that. Not to.
Yeah.
That's what's sad.
Well, I think, is it 70% of bankruptcies are due to health insurance
There you
stuff?
go.
Or
Yeah.
health
Yeah.
stuff?
Yeah. It doesn't have to be that way.
I saw that statistic. It was crazy.
Mm-hmm. Yeah, and the reason for that is because we're as a nation right now.
Mhm.
People are there's two problems. There's so many problems, but
Yeah, narrow it down to two.
here.
Sure.
In this situation, so cost shifting.
Okay.
The average deductible maybe not in this area in Dane County, but the average deductible is $5,000.
Is it really?
So before I even get any benefit from having health insurance,
Right.
I got $5,000 out of my pocket.
Wow. All right.
There's a problem. Right
And that
there.
resets annually, right?
Yeah, and then
Okay.
the second problem is I don't got $5,000.
Probably a common thing, sure.
The average American has less than $1,000 savings put away. So we're
Ouch.
all just one stub toe away from a
Sure.
bankruptcy, or not
Right.
bankruptcy, but being harassed
Right,
by an insurance company.
right. Interesting.
So though we have insurance, most of us are underinsured. And so at
All
this
right.
point, it's like, why
What
do
do
we
you do?
even have it?
That's a fair question, right? Because you're essentially paying for a promise you hope doesn't have to be kept.
Yeah, maybe a major car crash or
Right.
something. So anyway, so what I do is I don't necessarily take people down the status quo path of, okay, we'll just shop for a lower price.
Okay.
Because that's what we've been doing. That's not working.
It is
Shopping
not.
for a lower price.
Safe to say.
Because
Yeah.
you get the lower price, and then what happens?
Yeah,
We
it
just
keeps
go
going
up that
up.
escalator again.
It luckily goes up.
It keeps
right?
going up.
Sure.
So, so what I do is, we need data.
Okay.
Well,
Okay.
We need to know what kind of users, or high users, low users, whatever,
Mhm.
you have in your group.
All right.
Once we know that, then we can design a plan. What we do is we take it all apart. Right now, your health insurance company, or I don't know what you have, but it doesn't matter. There's certain components there.
Mm-hmm.
There's an administrative component that administers the claims.
Mm-hmm.
There's a component that is that is like for large claims.
Okay.
They call reinsurance. So
Oh.
if you have like a $70,000 bill or an $80,000 bill, your insurance company's not going to pay that. They have another insurance company that pays for that.
Really?
Yeah. So, because we need more complication.
I guess I'm surprised just that the $70,000, that's a lot of money from a hospital thing like cancer or
Yeah.
something like that. I guess that seems like a relatively low number.
But if, let's say I have a group of 100 people,
Sure.
and 3 people hit that $70,000 point.
So it's insurance for the insurance companies.
There's insurance for the insurance companies, yeah. So,
There's a middleman for everything, isn't there?
yeah, and then
Wow.
there's a whole prescription drug component.
Okay. Well, we didn't talk about that. Sure.
Yeah, yeah, that's another can of worms.
All right.
So if we pull these all apart,
Mhm.
and we go and we shop for your own administration, third-party administrator.
That's
your
a
own-
thing?
Yep, and your own, yes, and your own claims processor.
Okay.
And then you handle the claims that maybe are below 20,000 or whatever,
When you say you, do you mean the
The
employer?
employer.
Okay. All right.
or whatever. If you're a larger
Sure.
employer, it can be below 50,000, whatever. But we'll
Okay.
do the analysis for you and figure that out.
Sure.
And then you'll know what kind of users you have,
Mm-hmm.
and you can control that. I got a call from an employer that said, Barb, are we going to get a refund for the months of April and May because the clinics that were around where our employees are going are closed
Sure.
and we don't have access.
So there's no opportunity.
And I got a refund from my car insurance. Why shouldn't I? Because I'm not driving my car.
Fair question.
Why don't I get a refund?
Mm-hmm.
And I said, yeah, why don't you? And he's like, well, you're my agent. You should go.
Right. Get on
And
that.
I said, listen, that unfortunately is not the way it works. But if you were in charge of your own insurance plan,
Mhm.
you're not going to pay for services you're not using.
Sure.
Because right now, he's writing out this big check,
Mhm.
sending it to the insurance company for services he's not using.
Services, it sounds like they're not even available.
Right.
Sure. Which
Yeah.
is terrible.
Anyway, that's
Well,
just
yeah.
one example.
Mm.
So that's one thing we do. Another way to pay for healthcare is through something called medical cost sharing,
Okay.
which is not insurance.
Okay.
Essentially, it sounds like insurance. It's a group of like-minded people,
Okay.
all sharing each other's expenses.
Okay.
So the one I represent has, right now, they have about 20,000 members.
Whoa.
Throughout-
Okay, that's a lot of people.
Yeah.
That
they're
sounds
all
like insurance.
Sharing each other's expenses.
Okay.
So you pay a membership fee
Mhm.
into this, well, I guess I'll have to call it a pool.
Sure.
And then you submit your bills to the organization,
Okay.
and then they send you a check. So if you smash your finger like you did,
Right.
and you submit the bills
Mhm.
to the membership community, they'll send you a check for 5,000 or whatever it was. Then you go pay your bill.
All right. Do they tell me how that's different than insurance? It seems
Yeah,
awfully similar.
It's different than insurance. Well, number one, they're not contractually. Well, they will pay. They're contractually bound to not pay your bill.
Okay.
That sounds scary,
Right.
but there are loopholes in insurance contracts too.
Oh, I
It
bet.
also is not like government regulated.
Oh. Well, that opens some doors.
Yeah.
Okay.
And there aren't any, like, they're not bound by government mandates.
Mhm.
So they don't have to cover a certain state mandate. Like here in Wisconsin, there was an autism mandate.
Okay.
Like 5 years ago or something, like, more
Okay.
like 10 years ago.
Saying that it had to be covered?
You had to be covered.
Okay.
So then everybody, and I think that was a good mandate, but I'm just using it as a mandate.
Sure.
So, so then all insurance companies everywhere had to cover autism.
All right.
So medical cost sharing is not bound by the laws.
Is it also nonprofit?
It is for profit.
For profit. Okay.
I mean, what I mean is, well, let me back up.
Okay.
It's not nonprofit.
Okay.
But all the money is either put into a reserve fund
Mhm.
for larger claims
Mhm.
or pays administrative costs.
Gotcha.
So there aren't any shareholders?
So there's no shareholders, there's no golf classic that they have to sponsor or something like that?
No, there's no incentive trips for people like me.
Gotcha, okay.
Yeah.
They don't have their own private pilots or anything like that?
Nothing like that, so
Okay.
kind of bare bones.
Sure.
So
20,000 people, how do they get the word out? Is it through people like you?
yeah, so all the terms they use, so I'm considered an affiliate.
Okay.
So I'm somebody who is trained to educate people about their product and,
Okay.
and then bring them on, and then like an agent relationship.
Sure.
Yeah.
Are there many of these? Or is
There
this-
are so many. There are 15 or so or more in the country.
Wow.
And most of them were started inside of religious organizations. So the
weird.
Christian community has a lot of them.
Okay.
And that's where they were started.
Okay.
Actually. So think about, I don't know if you know much about the Amish community, but.
Horses.
Yeah, okay. But, they have their own health plan. They
I didn't know where to go there. Like, where do they go for the doctor or stuff?
they go where they want to.
Is there,
They see the same doctors we do.
and they're cool with the technology and all that kind of stuff? I just assume there's an aversion to technology with
Oh,
some
well,
of
they
that
want care. Yeah.
Okay.
So, but my point is,
stuff. Sure.
is that what they do as a community is they share in everybody's medical costs.
Interesting.
Yeah. So
All right.
they all pool their money together. So someone breaks their leg,
Sure.
they're going to pay for the bill.
So, 20,000 people, though that's a lot, I feel like if somebody got cancer or something really extreme, that'd be a bad day. So does that consortium of sorts have
They have
insurance?
They have a reserve fund.
Okay. Okay.
They have that, and then they have the ability to pay for the bill over 90 days
All right.
and stretch that out.
Okay.
They also have the ability to go to the members and say, we need a little bit more money.
All right. Okay. So it'd be like I don't know, where we're at here, it's a office condo. They need to.
Yeah, condo association.
They need
fee.
to dink around the parking
They're
lot or
like,
something
yeah, we
like
need
that.
to put in a new sidewalk.
Sure,
Yeah, so
sure.
everybody chip in an extra 20,
So
yeah.
but you can split it between 20,000
Yeah.
people.
Yeah.
It's less of a burden. than
Exactly. So the positives here is that there's no network.
All right.
Go wherever you want.
Oh, any doctor. So it's just a bill. As long as you got a
You
bill.
are a self-pay patient. What did I say about self-pay not too long ago?
All right. You know what it costs.
It's so normally.
Oh, it's a discount.
Yeah, normally
Okay.
30 to.
Sorry, there's a test here.
I'm sorry, you're making it.
No, you're good.
So typically, yeah, your bills are about 30% lower.
Wow.
So you're a self-pay patient. Go
All right.
wherever you want.
Okay.
They also have help in like navigating this for you.
Oh.
So you call up and say, I need to get this shoulder checked out. I don't know where to go, and they'll say, let us do some searching.
Yeah.
There's 3 specialists in your area.
All right.
This is the one we recommend.
Or a plane ride to Mexico and it's $10 or whatever.
There's that too, actually.
Okay.
Honestly. Yeah. Yeah.
That's pretty cool. So I feel like if I was an insurance company person, I'd be like, hey, let's stop these things from happening because they're essentially taking revenue, taking market share.
Yeah.
So has that been an issue?
Not yet, no. But they're not, there's a place for insurance companies, don't get me wrong.
Okay.
They're not meant to replace, sometimes they run alongside.
Okay.
So inside of a company, you might have a medical cost sharing plan and a regular insurance plan.
Wow. Okay. For different individuals
Yeah,
or
and
different.
the reason being is because, they're not all fairy dust and perfect.
Okay.
They do have pre-existing condition exclusions.
Okay.
So if somebody were to have cancer, like you mentioned, and are in the middle of treatment, then medical cost sharing is not a
Sure.
solution for them.
Okay.
Because in order to have your bills covered or shared, I don't like to use the word covered,
Sure.
having your
Even though
bills
they're covered.
shared, you have to have been symptom-free of that
All right.
for a year.
Okay.
So it doesn't work in every situation. And some people just aren't comfortable with it. They, some people are, like their traditional insurance plan, and there's a place for them. They want that. So that's why I'm not here to dismantle everything that's already.
Sure.
I'm just saying there's other solutions
It'd be
out
cool
there.
if you did. It's not exactly working.
I would say, the majority of my customers right now use traditional health insurance plans.
Okay.
But what I'm finding is that more and more people are willing to listen to other options.
Oh, I bet.
And so
They're getting squeezed so hard that
I'm willing
eventually...
to share them.
Sure.
And if you're the type of company that is wants to try something new and is open to it, then I'm your person to help.
All right. How do I want to ask this? There must be a minimum for the group for you to add. Is there a minimum of a specific company?
We for the medical cost sharing, we need four employees.
Okay.
So
fairly low minimum.
4 people on the payroll.
Okay.
Yep. To do the healthcare audit, where I kind of pull it all apart and do like a self-funded plan, I'd like to have 20 to 25 people.
Gotcha.
So
Okay, so you have a big enough pool that you can spread it around.
I need more bodies for that.
Interesting.
But there are all kinds of other things. So I'm part of an organization called Health Rosetta.
Okay.
And they are a group of employee benefits advisors throughout the United States.
Okay.
Right now we've got about 250 members.
All right.
You have to be invited and you have to be vetted to be in the organization. And essentially we're all committed to help each other. And so we crowdsource all the best ideas to bring healthcare costs down. So if something's working in St. Louis, we're going to know about it. We all share ideas and work together because we are, as a collective, working to change the focus and the shift of healthcare in this country. I can't do it by myself.
Sure.
I can work in, Dane County.
All right.
But there are people like me throughout the United States doing this, and in a bigger scale, much bigger scale, and for a longer period of time. So it's wonderful because I've got this whole network of people I can draw on.
Sure.
To help with the mission.
Interesting. That sounds pretty cool.
Mission focused.
Mission focused. I like that. So I'm going to ask you. I'm going to go out on a limb here and say that you have more experience with the healthcare field than most of the people that are listening, probably. So if someone, let's just say the government calls you up, right? Let's just say the president calls you up and says, Barb, we need this healthcare thing fixed. What should we do? And we're actually going to listen to you. How would you answer? Clean slate. Clean slate. Would you know? We're talking hospitals and all that kind of stuff. The buildings exist, the doctors exist, technology exists. But we're going to remove, let's say, lobbyists. We're going to remove even the admin function if you want to replace it. You tell me what you want to do or what you would recommend, I guess, from your point of view.
Well, that's a huge question.
It is a huge
question. I'm not stalling.
Okay.
I'm trying to...
No, it's a big...
and I'm trying to come up with so what I want to do is distill it down into... I'm going to distill it down into...
Fair.
One word.
Okay.
I know, look at your face. You're like, what the heck?
One word. I'm excited. One word. 42.
Transparency.
Oh, all right.
Transparency. So what was I talking about earlier was that we don't know what anything costs.
Right.
So if we know what something costs, the market will take care of it, right? I mean, if not only do we not know what it costs, but we don't know what kind of quality we're getting either. Just
not
because a surgeon A is charging $50,000 to replace your knee, and surgeon B is charging $15,000, you think surgeon B maybe wasn't that good, right?
Right.
How do we know that? Maybe the reason why surgeon B is only charging $15,000 is because he does 15 a day.
Sure, just pumping them out.
And maybe
do them in his sleep.
His outcomes are really good, but how do we know that? We don't know that. So transparency.
Well, there's no way to really vet doctors, is there? I suppose that's intentional.
Well, there's data. There's
Okay.
data. I mean, but do we get to see the data? There's tools where we can see the data.
Yeah.
I would say we need transparency. We need to know what things cost.
Yeah.
And we need to know how good they are. We need to know
All
if they
right.
work. We need to know if there's outcomes. If the outcomes are good.
Sure.
That way we'll get quality of care. We'll get quality care for everybody.
Yeah.
At a fair price. Now, I'm saying fair price to the doctors, fair price to the hospital, and fair price to everybody. There's enough money out there for everyone to get a fair price. But
Agreed.
right now, it's tipped, 100% tipped towards the people who aren't even providing health care, administrators, pharmacy benefit managers. Those are the people in between your pharmacist
Right.
and the drug manufacturer.
Middleman
There's someone
everywhere.
in the middle
Sure.
taking a huge cut, and those people,
They're not providing any
they're
value.
not providing value.
Sure.
Yeah.
Interesting.
So
I remember.
I'd say cut it all out and
Yeah.
let's see.
All
yeah.
right. Is that? Do you think we can do that? Like, do you think
We're doing it now.
we are? Tell me how. We solved it. Healthcare
trying my-
solved. You saw it here.
Healthcare is solved. You know, that's funny because that's the name of the book that one of the books I recommend.
Okay.
Where healthcare is solved, or the fixes are here.
All right.
And I could send you the links to some of the.
By all
there's
means,
some
yeah, yeah.
free downloads
Yeah.
of these books that our founder wrote.
Even better, right?
Yeah.
All right.
So the fixes are here.
Okay.
And when I say it's being fixed by health Rosetta advisors like me and other people who aren't necessarily health Rosetta advisors, but there are people out there who are doing this. The state of Montana
Okay.
was in the dumps financially just 4 or 5 years ago.
All right.
There's this dynamic woman who took over their health care for the state of Montana, negotiated contracts with each of the hospitals in Montana, and saved the state millions, tens of millions of dollars,
Wow.
and turned the state's budget around. Now they have a budget surplus. This is
You don't hear that
somebody
very often.
at the state level. So
Sure.
she's one person that's doing it. There
Yeah.
are people doing it all over.
Huh. That's pretty cool. So is that you?
That's me.
Okay. That's
But I
you.
don't know if you want me to get it.
No. You can
But on camera.
pause if you want. Wait.
This is somebody who needs help with their health care right now.
Right.
Oh, I'm so sorry.
No, you're good.
There we go. Yeah.
where
So yeah, it's being done right now, and I slowly. It's a huge boat, and we need to turn it. And just like when you choose one of those little ocean liners, one of those big ocean liners, they don't go.
Oh
like
yeah,
that,
it's not
you know?
nimble. Not nimble.
So that's a slow change. Slow
All right.
change, but it's happening.
Interesting. So there has to be some resistance in the insurance community or in the healthcare community.
Oh, I'm sure. Yeah,
because they're making a lot of money.
There is resistance. There's resistance among, when hospitals find out that employers will not pay these high prices. And employers will say, I will, you're charging 500% more than what this other hospital here is doing.
Right. 500%. That's
I'm not making
criminal.
this up. I'm not making this
Wow.
up. This happens.
Really?
Yeah, in some markets I'm not saying here.
Sure.
But in some markets in the
Could be
United
here.
States. It could
Sure.
be, I don't know. Well,
That's fair.
I'm not saying.
Yeah.
Yeah, anyway. So, I lost my train of thought. But, yeah, it's the price disparities,
Discrepancy.
discrepancies are crazy. Are
That sounds
crazy.
insane.
Yeah, so anyway, employers are the ones that, it has to come from the employers. The employers are pushing back. Why?
Right.
Because we're the ones paying the bill.
We're getting squeezed.
We're tired.
Not a fan.
And we want to attract and retain good employees, right? So we have to do everything we can
Yeah.
to do that
I lost an employee years ago to the UW system here.
because they have better benefits.
Oh my gosh, what they were offering him, I couldn't even begin. I wouldn't even know how to buy it. Like, it was one of those, like,
You couldn't buy it.
Yeah, I just like, I can't touch that. And I'm essentially, that means that me as an employer am competing with the government for this employee. I don't want to be competing with the government. That doesn't sound right. Because the government is kind of the ones that lay down the rules, right?
It doesn't seem fair.
Yeah, so I wasn't, like if I was him, I would have made the same move, right?
Yeah.
Outside of, he probably
Yeah.
is the worst boss, but whatever. From a benefits point of view, there's no I was no competition. So my concern was not, we should drag the government down. My concern was, how come I can't get that for my employees?
Yeah.
And I wondered, I still wonder why, I guess. Couldn't we offer something like that? Yeah, but I look at it from the perspective of, I don't like going to the doctor. I do everything I can to avoid breaking anything on my body.
Yeah.
So,
Yeah.
yeah, I'm paying for a promise that I don't want them to even be asked to keep. I'll just have it for peace of mind, and that's good right back there.
Yeah. Yeah, so most of what we pay for is for acute care. Like acute care is like hospitalizations, ER, ICU.
Okay.
That's like something major, happened.
Sure.
So a big portion of our premiums and or a good portion of claims are to pay for those kind of things. So right now, I just before I got here, I was looking over some claims data from one of my clients, and I was looking at. It was a huge hospitalization bill, $320,000 in January.
Ouch.
And in April, there was another $88,000 drug for one drug.
That was an ingrown toenail, right?
I don't know. The problem is I don't know what it is.
Oh.
Yeah, I don't get that data.
$350,000.
But my point is that. Of that population of 100 and so people in this group, only about 20 of them are high users.
Okay.
The other 80% of the people are just kind of run-of-the-mill kind of stuff, like they go to the doctor for, maybe their baby has a fever and they're worried about that, or maybe a mole or something, but mostly primary care.
Sure.
So 70% of care is primary care, and primary care is really quite inexpensive. I mean, an office visit's going to be $110, $120, that kind of thing. And so actually, if a person could have, instead of having a $5,000 deductible, if I could go to the doctor and not pay anything, I bet that's what your employee that went to the UW had, something like that. If I just pay nothing, wouldn't it make more sense to, instead of have a $5,000 deductible or a high deductible for like a hospitalization, but I can go to the doctor for free? Wouldn't that make more sense?
Yeah.
Because then you are also you're incenting people to take care of themselves.
Yes, in theory at least, yeah.
Yeah, before it gets to be big. And also, they'd see it as a benefit instead of being like, look, I can't go to the doctor. I got, crappy health plan, and I've got to pay all out of pocket.
Right.
I'm afraid, like, once I get there, then the doctor'll send me down the hall for an X-ray. And now this little, what a pain I had in my shoulder turns into $1,000.
Right. Now it's a bigger pain. Now you're stressing, and you're causing other health issues because you're stressing.
There's all kinds of things.
Right?
So another component of what we do is we design plans so that primary care will have zero to no out of pocket.
Wow. Well, that's impressive. All right. There must be a limit, I imagine, so you can't go every 2 days.
No limit.
No limit.
No limit. Unlimited care. Unlimited primary care.
All right.
No
so you're just
copay.
banking on people not being crazy.
We find that people at most care, like 70% of care, can be taken care of over the phone or the television.
Wow.
Think about it. How many times, like maybe you have maybe you're the exception because you're so healthy, but you have a family.
Sure.
I mean, how many times, there's something wrong and you're not quite sure what it is. And if you could call a doctor and talk to a doctor over the phone.
Yeah.
How many times do they say, well, we need to see you? I mean, not maybe.
Yeah, I mean, we call the nurse line between my wife and my kid and myself. Let's call it 3 times a year.
Yeah.
And maybe one of those you end up going to see primary care.
Yeah, exactly.
Yeah.
So if you could take care of most care over the phone, I mean, that cuts down costs.
Well, dramatically,
because otherwise doctors are paying for an office and staff and all of that. So if you can just diagnose somebody over the phone, like if they got pink eye or you can diagnose that kind of stuff.
Definitely.
And then just call in a prescription. And nicer for you too and your employees. Then you don't have to take off work.
Right.
And drive somewhere.
So 5-10 minute phone call versus thinking around.
So much more efficient to handle primary care like that. And that is actually the wave of the future. You're going to see more of that. And you know what? COVID's pushed us in that direction.
I think, we're in my empty office, right? So COVID has pushed a lot. I think it's interesting what's happening to commercial real estate. Because I was afraid to have my people remote.
Mm-hmm.
From a quality control management point of view, there's just so many things that I did, or that we did, I should say, internally, to make sure that you could maintain the quality.
Mm-hmm.
And I was worried that I wouldn't have that control when people were remote.
Okay.
But then you're forced to push them remote, and it's ready or not.
Mm-hmm.
Hope it works.
Mm-hmm.
And whether it was I'm either going to blame it on super awesome employees or sheer luck, because I would nowhere near blame it on my management skill. I was so mad when we had to go separate. So, well, I shouldn't say that. One of my employees was very afraid. So I'm just like, if you're afraid, just let's work it out, right? We'll just set it up.
Yeah.
So once I had 2 employees that were separate, then the rest
You
of
got
them
the
were
hang
just.
of it.
Yeah, then it was almost more of a pain to have the other employees in here.
Yeah, give them different
So just-
setups.
Yeah,
Sure.
so we're uniform.
Yeah. So COVID's actually, pushing us in a lot of directions.
Yeah. It's
And
interesting
so it's
changes.
no
yeah.
difference with healthcare. Healthcare is becoming more online,
Yeah.
more televisits, more video chats,
Sure.
that kind of thing.
I feel like the
More
last time I
access.
was at the doctor was for physical a long time ago. Let's say 2 years ago. And I remember going through and they weigh you and they check your height. And I'm like, I'm over 40. You can kind of look at me and just ballpark this stuff, right? What are you going to put on the height thing that's going to make you say, whoa, we got a problem here? That you couldn't just eyeball me and say, you're 2 feet shorter. Like, I feel like there was just this drama or this, they just.
I had to justify bringing you in.
Yes. I mean, I met with the doctor for less than 2 minutes.
Yeah, absolutely. Yeah.
So I felt like this was kind of some dog and pony show to
And-
justify the whole.
And then
we
charge
looked
your
at you.
insurance company.
Yeah. And I was like, can I opt out of the whole height and weight thing? I have no problem with them weighing
Yeah.
me and the height thing, but it's just time.
Mm-hmm.
Right? It's time out of your day.
Yeah, absolutely.
And that nurse probably has something better to do than weigh me.
Yeah.
Like, I can just tell you, I think I'm within plus or minus 5 pounds of what I was. I don't know.
Yeah.
I don't know. Maybe it's just
Yeah.
me, but it seems like
Yeah.
you wait and then
There's a lot of wasted time
Oh, a ton.
in healthcare. Well, there's that, but then not enough quality time either. Like you mentioned, you only get 2 minutes with your doctor.
Oh, I was pumped through like a horse at a glue factory, man.
So,
It's just pump them through.
Yeah, so that's part of the problem too, because if you don't have a personal relationship with your doctor, and maybe if the doctor would have sat down and talked to you for a while, maybe you would have uncovered some other issues, or maybe you would have been comfortable bringing up something,
Yeah, I don't mention a thing. Because I guess for me, when you have to fill out those forms that say, who is your primary care physician, I couldn't tell you.
You don't have a relationship.
No.
Yeah.
No, not, and
And healthcare's gotten away. I mean, I'm probably dating myself, but I remember when I was young, there was I went to go see my doctor, and my mom would take me there, and I would be there for 45 minutes.
I suppose I can remember a time like
And
that.
it was,
yeah.
he had his own little clinic on
Sure.
the street, and
Yep.
and he would sit there and ask me how school was going, and if I
Oh,
was,
yeah.
how was school going,
Sure.
and how am I getting along with my brothers and sisters, and and just I felt comfortable,
Yeah.
I
You're taking me down memory lane here.
But doctors, and it's not their fault. They don't have that kind of time because
No.
they operate in a system as fee for service, meaning like they have
Time
to
is money.
They have to produce so much in order to bill. It's a terrible system.
Yeah.
It's terrible. It's not quality.
So that evolved over the course of the past decades, right? Let's call it at least 3. I don't know what health insurance cost in the 1970s, but I have read books from the 90s where they were complaining about health insurance. From the 90s?
Yeah. Well, that's
So
when
I'm
I
like, that's
started.
30 years
I
ago.
started in the 90s.
Okay.
With my business, yeah.
Yeah, so I mean, there were business owners that were complaining back then enough to publish something. So I imagine in the 80s, did it get bad, or 70s? I don't know.
Yeah, I mean, we don't really have time to go down the history of
No.
what happened, but it was a layer upon layer of complication. But A lot of it has to do with the model of how doctors are paid. And how hospitals are paid. And,
Sure.
And, yeah.
All right.
And how that switched. It used to be a direct relationship between the patient and the doctor. So I also remember when I was leaving that clinic, Dr. Stadel handed a bill to my mom, and she got out, $5 out of her purse or whatever it was, and paid him right there. She paid the doctor.
Oh, directly.
Do we pay the doctor anymore?
No.
No.
There are 50 people that touch that payment. Right?
There are so many people in between.
Yeah.
So that changed over time.
Interesting.
But there is another, this has been underfoot, called a direct primary care movement. And so there are doctors setting up offices all over the country with that model. So you buy a membership into that doctor's office.
There's one locally here, right?
There's one on the west side.
Okay.
Yes.
I think I met them before.
You probably did.
Yeah.
Yeah.
Interesting.
It's more prevalent in other parts of the state.
Okay.
We need more here in this area. So you buy a membership, and then you have unlimited access to that doctor, unlimited calls and visits.
Sure.
And you pay just one membership fee a month, like belonging to a gym.
Sure.
You can go to the gym anytime you want, right?
Yeah.
So same thing. So that takes out the middle person right
That
there,
seems clever.
and you're paying cost. You're just paying the cost.
Interesting. And up front. There's no surprise.
No surprises.
That visit was $5 billion.
Yeah, so what I've been doing is I'm taking that model and I'm combining it with that medical cost sharing model I was talking about.
Okay.
So if you want to just, see a doctor for sore throat or something, and then you just go see this doctor. But then for like your major, let's say then it turns into be a major surgery, then you can submit your bills to the medical cost sharing community. Work those together.
Sure.
And so I saved a small construction company here in Madison around 50% off their traditional health insurance plan.
That is the luck I like. That's going the right direction.
They saved for 50%. The employees saved 70%.
Wow.
Over and then what he did was just a really generous guy. He went and he bought a dental plan for them. So he boosted their benefits. So they went from paying like out of their check was like $280 every other week to zero.
Wow. That's impressive.
And he had a dental plan.
Yeah, so they got better coverage.
They got better plan.
For less cost. Well, that sounds all right.
What's wrong
now
with
we're
that?
talking. Now we're talking. Interesting.
Yeah. So it takes a little bit longer to explain. I just took a call. Before I got here, I got some person, I don't know how he found me, but he said, Health Rosetta. He heard about Health Rosetta, looked up on the website, found me, and said, I see your Madison Health Rosetta. So he's like, it was funny because he was like, tell me about your insurance plan. I'm like,
the vaguest question in the world.
Now you know why it's funny. And I said, oh, well, it's not an insurance plan.
Sure.
It's there are concepts.
Right.
So
isn't that the hardest part in business when you're doing something relatively new?
Yeah.
It's the education aspect. Like, I can't even begin to sell you until you understand what we're offering, right?
Right, because people come to you with a certain mindset.
Right.
Like this guy came to me like, tell me about your insurance plan, because he thought I was an insurance company.
I need insurance. Right?
Yeah, tell me about your insurance plan, and I heard it was, better than what I have. And so I spent 45 minutes on the phone just talking to him about the concepts.
Sure.
Never ever got to any selling.
Right.
But so these things take a lot of time to explain.
Interesting. So how do people find you? Is it just through this Rosetta thing? Or
well, in terms of these ideas?
Just random clients, people that want you to help them. Is it referral? Is it advertisements?
Right now, I work on referrals.
Okay.
And I have a podcast.
Nice. I was going to ask you about that. We could talk about healthcare. We could talk here for 10 hours.
I know. There are a lot of topics. So I started a podcast so that I could hit all those topics.
Sure.
So there's that. And then, Health Rosetta has been great because I'm on the Health Rosetta website, healthrosetta.org, and I just encourage anybody just to go out there. And if someone should see this, well, you said you have a small audience, and
Only the important people, right?
we do have
Small but valid.
we do have a national conference coming up. Now, conferences are all moved online.
They got weird. Yeah.
So we have a national conference coming up, and I can invite 5 employers to this conference with a code to get in free and learn more about Health Rosetta.
Oh, really? Okay.
So if somebody's watching this and wants to learn more about Health Rosetta and the concepts, the other thing is, like I said, we're collective, a collective mind. If you're maybe in another state and you see this and you want to work with somebody more locally, that's fine. We all work together.
Sure.
We're not, it's really different mind shift. It's not all, we're focused on the mission, not necessarily on what's in it for me.
Right.
Because I feel like, because we're here to change healthcare.
Which is a tough nut to crack.
So we're all working together. So anyway, I've got 5 codes. Not that I came in here to promote this, because I didn't. I just thought of that. I'm like, okay, the conference coming up.
This is a small but valid audience.
I've got to get 5 people to come. So I have codes. So they can just email me or find me on my website, whatever. Shoot me an email and say, I want to hear more about that.
Sure.
And there's some national speakers you'll really learn a lot.
Nice. When is that happening?
It is August 5th through the 7th.
Oh, so you're talking a couple weeks? Sure.
Yeah,
All
I
right.
gotta get cracking. I gotta get people to. Well, I don't have to, but I feel like it'd be a waste if I don't get some people to,
Right.
join.
Spread some knowledge there.
Yeah, exactly.
That's all right.
Since it's free, and we're not selling a darn thing. There's nothing to sell.
It's just awareness, education.
It's education, and then once you, just like this person who called me today had read a book, one of the Health Rosetta books. He just stumbled upon this. He's like, I saw this book and I was reading it and I Googled Health Rosetta and I found you. I'm like,
was that a clinic somewhere?
I feel like you're just walking down a trail and you found a rock and you turned it over and had my name on it.
There's worse ways to market.
I know, it's not really targeted, is it?
It's all right. It does the job.
But, part of it is, too, that it has to be an employer with the right mindset. Someone who doesn't like change, not my client.
Not mine either. No, I get it.
Yeah, and someone who...
That's tough to find alone right there.
Yeah, someone who, if you just don't want change, don't want to disrupt, and you don't want... But you're not my client.
Right. Right.
I found such cool people, oh my gosh. The people that want to change are the coolest people, like...
Well, they're the real entrepreneurs.
Yeah.
Because that's the whole reason for...
And I love saying, listen, I'm learning this too, along with you. And you know what they say? That's great. As long as, and I say, as long as you're willing to be open-minded and come along with me, I'll explain everything to you along the way. I will be completely transparent. If you're willing to do that, come on!
Yeah, as long as
Get on the bus, let's go!
As long as, I guess... The challenge is that they just want to make sure that they're covered in case of catastrophe, right? That's the whole point of all that.
Well, of course. I mean, yeah, I'll explain all that. I'm just saying, if you're willing to listen to other options for paying for health care.
Well, then totally. Yeah, 1,000 times over.
Jump on the bus. You can always jump off. I'll slow down. I'll slow the bus down and open the door. Then
we can time out. It's all good.
Have a good day.
Sure.
That's okay. That's all right. Yeah.
So then, how do you get paid then? Do you get something from Health Rosetta?
I love this question.
Oh, you do? Well, because health insurance, the whole commission thing, that got flipped upside down.
Well, I don't know what you mean, but...
Not long ago, didn't it? Wasn't it they turned to flat rate or something like that?
Never. I don't know.
Okay.
I don't know.
Apparently, I don't either. I don't know. I never sold health insurance, so I don't know what the game is.
So that's also part of the problem.
Okay.
So what was the word I used before? Transparency?
Yes.
That's also part of the problem within my industry. Most employers who buy healthcare don't know what they're paying their agent.
Have no idea.
Because it's never been disclosed.
No, they just give us a price for the insurance per employee, and then...
They get paid.
I don't doubt they get paid.
Yeah. But you don't know how much.
No idea.
So part of Health Rosetta is that we are transparent.
All right.
about what we get paid. So we give you a contract. Well, it's not a contract, but it's more of a, I don't call it, contracts are scary.
An agreement?
A disclosure.
Sure.
That says, this is all the ways I get paid for helping you, educating your employees, and so you know up front. And then if you look at it and go, I don't think you're worth that number. But how I get paid. So there are commissions that are in regular insurance contracts, fully insured contracts, and there are commissions in self-insured contracts. And so that's how I get paid. If it's fully insured, that's how I get paid. And if it's level and funded, that's how I get paid. If it's medical cost sharing, part of what you're paying, a small portion of that, is a fee to me on a monthly basis.
Okay.
And yeah, so that's, and if I come up with a solution where nothing is like baked in, then I will charge a consulting fee.
Gotcha.
And I'll tell you up front, this is what it is.
That's fair. Nobody works for free.
No.
Yeah, nobody should.
But I have this is like a true confession, but like I want to about 5 years ago, James, I was getting really tired of this industry.
I don't doubt it.
I felt like I just sat across the table from people like you and just asked for more money.
Right.
And gave you nothing.
It's a tough nut, right?
And gave you nothing in return.
Yeah.
Or basically said,
you're lucky.
Yeah, you're lucky. Yes, you're lucky. Or guess what? If you want to have like a less of an increase, why don't you just increase your deductible?
Sure.
Tell you what, you get less and pay them more.
Right.
You're lucky.
Right. Yeah. I would get tired of that too.
I got tired of it. And then I went to this conference in Florida when they were in person.
Back in the day.
Before COVID. And I learned about this speaker stood up there. His name is Dave Chase. He's a nationally known because of he started this movement, Health Rosetta. And I heard him speak about healthcare being broken, but the fixes are here. And I wanted to learn more about it. I applied to be a Health Rosetta advisor, and I was picked.
That's cool.
I was plucked out of the bowl of cherries.
Nice.
So anyway, ever since then,
Yeah.
I've been re-energized.
Oh.
Re-energized with my business and re-energized because now I have a purpose.
And now you have solutions. You
I
have
can
tools.
sit across the table from you and say, James, if you want to keep doing what you're doing, I'll help you do that.
Mm-hmm.
Yeah, everybody else, I can do that. Or I can bring you another solution and have you look at that. And that's your decision.
All right.
Either way, whatever you want, I'm going to bring you, like, instead of just giving you the burger, you can choose the salad and the chicken sandwich.
Interesting.
Either way, you'll get to eat.
Yeah, and it might cost you less.
Well, better.
You're more
Better. What's the point if it doesn't?
Well, you raised an interesting point about better care, or you can go wherever. Like, it sounds like there's a simplicity that has value as well.
Exactly. Yeah. Yeah.
But maybe that's just me. I just
find it so interesting when people like, I hope not too many insurance reps are watching, but
they're too busy hustling.
When they come and they approach me and they say, well, what can we do to get more customers? Can you tell us what the customers want? I said they want to pay less.
Right.
Well, besides price, is there anything else we can do? I said no.
What else do they offer?
What like a wellness plan? Like
I mean, they're selling us essentially a piece of paper. So to say that besides
what
price,
else can we do for them? Like, what, process claims faster?
Right.
Pick up the phone faster?
They already offer next to no value. So.
Well, I'm not going to go there.
Yeah.
I'm not going to go there. I'm just saying. By the way, I didn't say those things. James did.
I totally said those things, and I'll totally say them again. Happy to.
The views expressed by James Kitteman are not the views necessarily expressed by me.
They're bold-faced caps, underlined, italicized. Yeah. Happy to. I'm totally cool telling people how I feel.
It's your show, man.
That's why I got a podcast, right?
It's your show.
Yeah.
Oh,
but on your podcast, you can tell people how.
I don't do opinions on my podcast.
None?
No.
You should. They're fun.
Well, some. But mostly I bring a guest on.
All right.
And they do most of the talking.
Sure. All right.
So I sent them the questions ahead of time, and so.
Oh, no. You're taking out the authentic part. I'll tell you a quick story, right? I had a guest on the show, and they asked what I'd be asking. I just said, we'll just have a conversation.
Mm-hmm.
We'll just see where it goes. And they asked for questions ahead of time.
Mm-hmm.
And so I came with some, and I sent them.
Mm-hmm.
And I thought, I better adhere to those.
Mm-hmm.
So I asked them some questions, and it was like I was talking to a robot.
It was okay.
That guy had practiced and rehearsed, and it was a mess.
Didn't want to look bad.
No.
Yeah.
It was and it was one of those businesses that was it wasn't a heavily regulated industry or something.
okay.
It was probably the most boring industry in the world.
Okay.
So I was like, what are you afraid of? But it might have been just
Okay.
at the time we didn't even do video. So
you like more of a free flow is what
totally. I said we're just having coffee, just without coffee with microphones.
Coffee with microphones.
Yeah, because we
Ooh,
can't.
that's
Well,
good.
yeah,
I
we
like
can't do
that.
shared mugs now. So I don't know.
Of course not.
It's a different world.
So
Yeah.
anyway, what were we talking about?
The health insurance salespeople
Yeah, so I'm just
worrying about what to sell or how to sell
yeah.
it.
Like so, I always say like price.
Mm-hmm. Mm-hmm.
Sorry, like we don't sell on price. I'm like, well, I'm not asking
They
you.
do.
Yeah, we don't sell on price. I'm like,
Yeah.
After a while,
Mm-hmm.
that's what matters.
Right. Right.
Because I mean, we have great health systems here, world-class healthcare systems, and I tell you, like I mean, they're both good. I mean, all of them are pretty good.
Right.
And I'm just saying, like, you want to differentiate yourself.
Oh, company X versus company Y.
Yeah. Like
You both have
I understand
super
you
awesome
want,
things.
I understand you want to differentiate and get in market share, but it comes down to like employers, what can they afford?
Right. Oh, absolutely. Right, because we have to sell our widgets or our service to those widgets.
Yeah,
in
we're
order to
not
pay for that health
in a
insurance.
place right now, especially now with COVID and the economy.
Right.
We're not in a place right now to be like, okay, well, I'm willing to pay more because I think I'm getting more.
Money everywhere.
Yeah, it's not like that.
No.
I'm not saying we pay less and get less. I'm saying we pay less and we get value.
Yes, I think value is the key word there. And with the
Quality.
transparency that you're recommending, we could be sure that we
You
have
are
it, right?
a quick study, James.
I think
Transparency.
No, the name of the game is you made it easy, right? Transparency is the golden word. I'd never even considered that. Never even considered that, but it makes sense. Because I guess for what I pay, I couldn't even tell you what I'm getting.
Mm-hmm.
It's so complicated. I've had potential employees sitting across from me, and they asked me to explain my healthcare plan.
Oh.
And I'm like, we got an HR company that takes care of that because they give me a document that's 42 pages long explaining what it covers. And I give it to the employee, and I say, this is what I believe that this says, but you better read it on your own.
Yeah.
And the HR company will have a talk with you to help explain it because presumably they understand it more.
No, they probably do. Yeah.
I like to think so, but I don't
Yeah.
know.
Yeah.
That comes down to transparency, right? I have no
Yeah.
idea.
Yeah.
Which is probably not what the potential employee wants to hear. But when I think about it, my competition as employers looking for the same employee, I don't know that they're doing it any better.
Probably not. Probably not.
So, but I think that's kind of the whole thing that I found with healthcare is that there's a lot of smoke and mirrors to prevent people from price shopping.
Yeah, the problem too is that people associate health insurance is not health care.
Fair, totally fair. Totally
Yeah.
fair.
Can you imagine, like, auto insurance is not auto repair?
Right.
Like, can you imagine that? Like, you're paying your premiums into your insurance, into your auto company, and you think of, they don't tell you where to go to get your car repaired.
Right.
Some of them have, like, places they recommend, whatever.
Mm-hmm.
But it's up to you where you get to go.
Mm-hmm. Mm-hmm. Yeah. That's a whole tangled web. We won't go down that road. Talk about body
Is
shops
that a bad
and stuff.
idea? Okay.
Oh my God, it gets worse.
Anyway, health insurance is not healthcare. Healthcare is, again, it's the doctor-patient relationship
Sure.
that's gotten in the middle.
Yeah, it's
people in the
gone.
middle.
Yeah.
Yeah.
Interesting. I feel like we can fix this.
Well, it's being fixed.
All right. You're doing it.
There's hope there. Hope, and it's happening. Not just
Sure.
hope, but it's happening.
Not just hope. Okay.
No, it's happening.
As long as it's better than hope. Hope is.
Yeah, more than hope.
Okay.
There's solutions, and it's happening.
That's cool. So how can someone reach you? If they had more questions.
You have to walk down a road and turn over a rock.
Okay. It's going to be a lot of rocks.
It's very,
Or you're going to have a lot of magic markers.
very exclusive and elite. No, you can obviously call my office. Do you want me to give the phone number?
Totally.
Oh, okay. Okay, get a pen.
Sure.
608-310-7040. And then any extension, just listen to the menu.
You are extension 104.
I am, and the wonderful Buzz Kemper's voice comes on and tells you.
I knew I recognized that voice. I knew it. I interviewed
Yeah.
Buzz, I don't know, a
interviewed-
year ago, something like that?
Yeah.
Yeah,
So
he's a good guy.
He's our voice on there.
Okay.
And anyway, or you can email me at bschlaefer@jcrose.com.
Spell Schlaefer for me.
SCHLAEFER.
Gotcha.
And if you don't remember any of that, just Google JC Rose.
JC, the initials,
J
Rose.
and C as in cat and rose like the flower.
Nice.
And then Google that, you'll find us.
Very cool. Very
Yeah.
quick. How did that name come about?
Ooh, thank you for asking. So, JC Rose. So I'm a mother of 3 boys.
Mm-hmm.
And when I was pregnant with my 3rd boy,
Mm-hmm.
I didn't know he was a boy.
Okay.
And didn't get to know the gender, And so my mother was alive at the time. Her name is June Cora Rose.
Oh.
And I told my mom, if I have a girl, I'm going to name her Cora Rose.
Ah.
And then Jonathan popped out.
Jonathan.
So right about that time, I started my company.
All right.
So I named my company after my mom. So she's my other baby.
Sure.
So
That is so you had a kid and started a company? Same year?
2000, no. No. So 2004, I had the baby, and then
Gotcha.
2006, I started the company.
Closing up. 2-year-old
Yeah.
kid and still starting
Yeah, I was
a
going to
company?
have any more.
Okay.
So after I had that last baby, and then
Sure.
I was about ready to start my company.
That's cool.
So JC Rose, named after my mother.
All right. That's impressive.
Thank you.
Awesome. Well, Barb, thank you so much for being on the show. We covered a lot of ground.
We did. I feel like we did.
I
feel like
winded.
I feel like I'd be here all afternoon, but I would need like something to drink.
Sure, that's fair. That's fair. I'm so afraid to give people stuff to drink now.
Oh, really?
I am. I'm just afraid. I don't,
Yeah,
because you never know what level of fear people have.
Sure.
I had somebody. It doesn't. Yeah, it got awkward when I offered somebody something to drink.
Oh, okay.
You're getting out wipes and stuff. Like, what do you think is in our fridge? Maybe it was fair. I wiped it down. I don't even know what's in
Yeah,
our
okay.
fridge. Anyways,
Anyway,
this has been Authentic Business Adventures, the business program that brings you the struggle stories and triumphant successes of business owners across the land, coming to you in our somewhat vacant office in Sun Prairie, Wisconsin. But we're on the air at 103.5, and that is underwritten by Bank of Sun Prairie. If you're listening to this on the web, please like, subscribe, and share. Authentic Business Adventures is brought to you by Calls on Call, offering call answering and receptionist services for small businesses across the country, on the web at callsoncall.com, as well as Draw In Customers Business Coaching, offering business coaching services for entrepreneurs in all stages of their business, on the web at drawincustomers.com. And of course, The Bold Business Book, a book for the entrepreneur in all of us, available on Amazon and wherever fine books are sold. We'd like to thank you, our wonderful listener, as well as our guest, Barbara Schlaefer, owner of JC Rose and Associates. Barbara, the website again, was it jcrose.com?
jc-rose.com.
jc-rose.com. Find us airing on 103.5 Wednesdays at 1 p.m., Sundays at 2 p.m., as well as at sunprairiemediacenter.com. Past episodes can be found morning, noon, and night at the podcast link, found at drawincustomers.com. And that's pretty much all we got, right? Thank you for listening. We'll see you next week. I want you to stay awesome. And if you do nothing else, right, enjoy your business.